Okay, everyone, I think we're ready to get started. I hope I have a thumbs up from my Zoom room crew. And clearly, I think the people in the room can hear me just fine. So welcome, everyone. We're delighted to kick things off for the October Health Innovation Community Partnership meeting. Let's go ahead and dig right in. Oh, and I've even got a slide advance. How exciting. Fancy technology. All right. So as we know, we are joining here together again to discuss issues and priorities and programs pertaining to the communities around the Los Angeles General Medical Center as part of the initiative and mission of the Health Innovation Community Partnership. Delighted to be sharing space with you today and bringing some very interesting presentations for your thoughtful reflection and for our mutual discussion. As you know, this meeting is being recorded, and the recorded version of the meeting will be available on the HICPLA.org website in about a week's time. We want our time always to be interactive and to really have time and opportunity for conversation, for questions, and for thoughtful reflection on the issues we're discussing today. Meetings are simultaneously available in English and Spanish. So if you're in the Zoom room, please go ahead and select the globe for the language of your choice. We also encourage dialogue by asking questions and by putting questions and comments in the chat. So please, again, be as interactive as you can. Bring your questions forward, type them to us, raise a hand, and we'll give you time at the appropriate moment to ask questions of our presenters. Wanted to just acknowledge a couple things as we kick off our meeting. We are in the very tail end of National Hispanic Heritage Month. We had plenty of really wonderful celebrations here at the medical center as well as in the larger community, and we just want to acknowledge this wonderful and important celebration. Additionally, next Monday, a lot of county offices will be closed to celebrate Indigenous Peoples Day on Monday, October 13th. Let's take a quick look at our agenda as we get started. We will have our update from the Los Angeles General Medical Center. We have some updates from our friends at the Department of Economic Opportunity. We'll have a presentation on emergency rent relief, as well as a special events report back from our friends at Centennial Partners. And then we're going to spend a little bit of time talking about the CASHI initiative, which is the California Accountable Communities for Health Initiative. And then, of course, we'll end, as always, with opportunities for any of our partners to bring forward their announcements and upcoming events. To begin today's meeting, we will, as always, read our Health Innovation Community Partnership Guiding Principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants will agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And to kick off today's meeting, I'm delighted to welcome one of our fabulous medical professionals here at the Los Angeles General Medical Center. Dr. Rebecca Trotzky-Sirr is going to kick things off for us. Rebecca, I'm going to need to pass you over a microphone.
Thank you.
And here's your little slide.
Fabulous. Hello. Listen to me. Thank you. Hello, everybody. My name is Rebecca Trotsky. I'm a family medicine physician, which means I get to see everybody from birth to grave and everybody in between. And I am the honor and privilege to run the community medicine and addiction medicine departments here at the hospital. So one of the things that has happened in the past couple of years we know about is the opioid epidemic and the high rate of opioid overdose deaths in Los Angeles, particularly among people who are unsheltered, people leaving jail, people of color. And our hospital has really been a leader in the nation of providing excellent community-based services for all of this population. When we learned recently of some unusual deaths in the community, we wanted to let people know about some of the challenges and new drugs facing our community. In particular, this drug called kratom, which I've learned is a Thai word. It actually comes from a tea leaf that historically makes kind of like a stimulating coffee, green tea-like substance. And people have learned with synthetic fabrication, it becomes even more mind-altering. And this is what's currently being sold across Los Angeles and across our nation. And there have been 3 deaths recently, specifically with this product. And one of the challenges is because it's sold in places like a gas station or a grocery store, some people don't know that it can have dangerous and mind-altering effects. So the other challenge is it doesn't always look like a medicine. It can look like a soda or a juice or a gummy bear. It is derived from a plant alkaloid. So sometimes it's even just called plant alkaloid. So you would think that it could be safe and natural when in fact it can be very dangerous. So the other form it comes in is the synthesized form that makes it really strong and mind-altering is called 7-OH. And that often becomes just 7 when it's being like sold in the gas stations. And you can see that it even can look like a candy bar. So this is an unregulated substance, which means it's not controlled or regulated by the government. So things like sugar, flour, eggs, those are all certified to be safe for us to consume. But this product is, who knows what it is, right? It could be what it is, or it could be something synthetic, or it could have extra things added into it. So this is the other feature, that it could make it extra dangerous for people. And it does change people's minds. Now, originally this was just like a green tea or just like a coffee that we drink, and it was safe for the indigenous communities in the area that were consuming it. The synthetic product is not safe. It is something that some people who are intentionally trying to consume it are looking to treat maybe depression, anxiety. It's sold for energy, things like this. Some people even say it's used for chronic pain. And it's true that some of these features it may address. It is not FDA regulated or evaluated, so there are not known to be, let me say it this way, there are safer ways to get those needs addressed. If people in the community have those health needs, we would love to address them with you here in the hospital, rather than you going to a gas station and taking something that could be who knows what. There's a lot of different brands. This is what makes it extra challenging, is that it could look like so many different things. It could like something totally inert. It could be called a plant alkaloid, and your 12-year-old might be thinking that it's just like a 7-Up. When you take a low dose of this, it is increases energy and alertness, just like a coffee or an espresso would. At a high dose, which is now what this synthetic product is, it acts like an opioid, which is just like heroin or Norco or M30s. And that is, on the benefit side, it does provide some sedation and pain relief when it is regulated and supported by a healthcare provider. But in this setting, you really don't know what you're getting. And so people take the high doses of it and then actually become addicted to it. So we have heard stories of people, thinking they're just getting like an energy beverage from a gas station, starting with one of these energy beverages and then really rapidly escalating to like 12 a day. And they're very expensive. The deaths that we saw in Los Angeles County were from the synthetic product and often mixed with other things, but those other things could be just like alcohol, something that you would maybe have at a party with this medicate or with this uncontrolled substance. the good news about this medication in terms of what I think about in terms of healthcare providing is that naloxone or Narcan does reverse an opioid overdose event, even from this medication. So while I don't anticipate a lot of people are intentionally using this medication or substance for opioid relief, if you did encounter somebody that was having an overdose event, they're found down and you knew that they were using this, or you thought that they could be using drugs, naloxone, which is something widely available here at our hospital, including for free at the wellness center, does reverse an opioid overdose event. And the treatment, so this is the things that my healthcare team helps provide, is a really safe medication called buprenorphine. So if you have a family member or you yourself are struggling with chronic pain, taking too much of a pain medicine, or perhaps even using an unregulated substance like this, we are here for you. We're here to help you with your pain. We're here to help you with your addiction. We're here to help your family member. And we really are the national experts in this kind of thing. So my intention today is just to alert the community, just be on the lookout. This might be something that be on the bottom shelf of your grocery store or your kind of bodega store, and really just be a little more mindful about what your youngsters or your family members might be consuming. And again, people might be knowing what it is, but they might not be knowing what it is. And that's what makes it particularly dangerous for us. I will pause here and see if there's any questions from our community or from our online group.
Do we have any questions for Dr. Trotsky? I have a question or two.
Yeah.
So you say that the original substance is from, thank you. The original substance is from Thailand, but now is it mostly being manufactured locally or?
So it is a really complicated manufacturing process to take the chemicals that make it act like an opioid or a drug. And so we're thinking that these are more fabricated out of the country and then imported as these things that look like, again, like the products that you'll see here, these tablets, these energy drinks, or these bars. And so, sometimes I kind of say, if you see something at a gas station and it claims to regulate or change your mind, it is probably not safe for you. And that is something across the board. So it is sold at smoke shops, at big stores, and a lot of other products like that.
Sorry, I was panting into the microphone. My apologies. I'll keep it away.
One of the great things here working at our hospital, and I'm so fortunate to have great leadership and community support from you all, is that we do provide a hotline for everybody in our community who can call 24/7 to get support. My addiction medicine team, we really love to hear from our patients or community members, right? We have a lot of times, my girlfriend was a patient and now I'm here, I'm wondering if you can help me. So we love to get community referrals. Our phone numbers are up here. This is our hotline, 323-409-6623, that gets directly into the Los Angeles General Medical Center team. The DHS MAT hotline is our 24/7 for, if you live in the South Bay and you want to get connected to resources somewhere else. And then the Department of Mental Health, or DMH, has a 24/7 access helpline that helps also with, you just need somebody to talk to, you're feeling depressed, helps connect you to the full range of services we have in our county. My personal email is up here, and if you have any questions, feel free to reach out. The messages I really want to hope to leave with you is, while this might be a little bit fear-inducing that there's an unknown product now in our community that could cause harm, the good message is that we have really safe and effective treatments here at the medical center that we want to share with you, and that it's something that we can do together to really help improve the health of our community. So thank you so much for your time and attention.
Yeah, thank you so much, Rebecca. Really appreciate it. And it's wonderful that the medical center, again, has those resources, and it looks like we're really available to reach out to the center if you have those questions, if you see things in your community and you really want to know more and to maybe get some resources and responses. I'm going to give this back to you because it looks like we have a question from Vivian.
Thank you and good morning. So we know that the opioid crisis has actually taken over, and the medical creators of that have become extremely wealthy. but it's still not off the market. So how are we actually going to protect our communities if this is actually on the market to purchase at almost any place that you can go? Is there anything that's going to actually take place to prevent these from being sold?
Yes, thank you for mentioning that. This is still working, I hope. The FDA, which, we have lots of challenges with our new federal government making misstatements about health education. In this small area, this is a very strong piece of the federal awareness in terms of getting the FDA to start calling this drug illegal, to start preventing marketing for, a soda that isn't actually what it is, and going after the manufacturers. One of the challenges in the unregulated market space is as soon as you squash one product, another new one comes up slightly different, right? Like I would not be surprised to see 8OH as opposed to 7OH pop up once we squash that one. So the broader message is more around addiction care, I think, and the underlying symptoms that really bother somebody that drive them to want to seek a product like this, and encouraging people to seek care from, established, trusted community partners like ourselves or other community clinics.
Thank you so much again. Yes, in addition, of course, to the unregulated products, which we're talking about today, you also mentioned, Vivian, some of the, the prescribed products and the problems that have been experienced there. But again, I think the best thing we can recommend is to take note of these numbers that are on the screen right now. Dr. Rebecca and many others in the county are very, very cutting edge in terms of treatment, awareness, and education on these issues. And so if you want, or if you have groups in the community, Vivian, that you'd like presentations given to, or others, there's an incredible team of street medicine folk, as well as the addiction medicine specialists here that can help bring that messaging and bring that awareness. But it is, I think, it is an opportunity for vigilance from a lot of people in the community to just be mindful, be aware. It's that if it sounds too good to be true, usually it is for almost everything. But we know there's a lot of pain in the community too, and people are looking for relief from that. So helping direct people to mental health services or other resources is another very, very important thing to destigmatize people looking for help, so that we can connect them to the right resources. All right. Well, I thank you so much, Rebecca, for joining us today. As always, we love when you come and give us these snapshots from the cutting edge. I had never heard of this particular product, so that is very new news to me. All right. Well, we're going to move on in our presentations now. We are coming up to some wonderful feedback and interesting information from the Department of Economic Opportunity. I'm going to invite Maurice and Laura to come up and speak with us. We've got a couple little notes and words from the Department of Economic Opportunity. I'll let Maurice and Laura share with us about the Small Business Resiliency Funds, as well as some feedback on some other DEO initiatives.
Good morning. My name is, and can everyone hear me okay?
Yes, we can hear you.
Great. Good morning. My name is Maurice Goldstein. I'm the Program Manager for Economic Development Services with LA County Department of Economic Opportunity. I'm joined here by my partner, Elainne Rodriguez, Director of the Los Angeles Economic Equity Accelerator and Fellowship. I would also like to share an update on the Small Business Resiliency Fund, which we've been able to launch on September 29th to support businesses that have been impacted by federal immigration enforcement actions in LA County. Next slide, please. Oh, pardon me, which one? Oh, this one, thank you. Great. First, a little bit about DEO. I'm sure DEO has been here at HICP over the years. We help to LA County to work, live, and do business in LA County through a range of different services. We are mobilizing resources, partners, and programs to ensure rapid response and recovery for local businesses, workers, and communities impacted by economically disruptive events. I'll share a little bit about our work around immigration enforcement impact more broadly, and then get into the Resiliency Fund, which has applications open until October 31st. DEO has served a range of efforts, including responding to the motions and reporting back to the Board of Supervisors across impact and activities in LA County. We have launched a centralized resource online. If you have not been to the site, please visit opportunity.lacounty.gov/immigration for a range of resources. We'll be posting and are finalizing an extensive resource guide and small business toolkit that will include on the site as well. There are videos, toolkits, and a lot of resources on our site. We are also working with LADC on releasing and collecting information on an impact survey that will be able to provide more detailed information as to the local impacts of immigration enforcement action. Please take a look at the survey, share it with your networks, and we appreciate that. Additionally, there will be some town halls coming up in the coming weeks, and I'll let Elaine share a little bit more about that in a moment. And we've recently launched the Small Business Resiliency Fund. This is a grant program offered by the Los Angeles County Department of Economic Opportunity that provides up to $5,000 in financial assistance for small businesses that have encountered economic disruption due to the immigration enforcement actions that started in June 2025. Applications are open through Friday, October 31st, 5 p.m. If you go to opportunity.lacounty.gov/resiliency fund, you can find all the information on the program, including application guides, the link to apply. Application guides are in 13 languages. So please visit the site and share this with your network so that they can have all the resources to be able to apply to this program if they are eligible and interested. In terms of eligible impacts, businesses that are applying must have an eligible impact, which includes temporary closure or reduced hours, property damage due to protests or enforcement actions, labor impacts or shortages, or related revenue loss. In terms of the eligible uses for the grant, it can be used towards rent, payroll, equipment repairs, inventory placement, or other recovery expenses. And I'd like to also clarify that it is $5,000 for brick and mortar businesses and $2,500 for independent contractors, sidewalk vendors, and eligible home-based businesses. After completing the application online and submitting basic business documents, well, actually here, let me talk a little bit about the some of the eligibility criteria. Businesses must be headquartered in California, located in LA County, be majority owned and managed by the applicant, must have a revenue of less than $6 million or less than 100 employees. Businesses must be active and in good standing, operating from brick and mortar commercial spaces, independent contractors, sidewalk vendors, and certain consumer-facing home-based businesses that have an establishment license or relevant permits. After completing the application online, an applicant will receive a notification to visit a community-based organization in order to verify what the impact has been. This includes ICON CDC for North Valley office and the South Valley office, via CDC over at 1130 Slauson, and with our partners with LEEAF. You can also visit or contact AidKit if you have any technical issues with the application. The number is over here on the screen. If anyone would like to take a screenshot or capture this, I think the slides will be available afterward as well. And all this information is on our website. And then you can also contact the Office of Small Business for any general questions at our East LA office and through this number here. And let me pass this over to Elainne from LEEAF.
Thank you, Maurice. Hopefully everybody can hear me okay. So as Maurice mentioned, all the community organizations are really working hard to ensure that we are available to answer questions or to support you with the application process and verify documentation as verify documents, documents and information that you've submitted to the application. So on the website, you guys can see all of the different locations for the organizations. We've done a really good job at spreading ourselves across the county so that it's easy for the small business owners to reach us and to find us. As far as LEEAF is concerned, we are doing a mobile pop-up operation. So you can find on the website, once you click on our link, you'll be able to find this handy dandy document that shows all of the locations that are coming up. So as you can see today in the afternoon, we're going to be in East LA. Tomorrow we'll be in Montebello. We are prioritizing like evenings and weekends to ensure that business owners are able to reach us and are able to get the support that they need. All of the locations do offer at least Spanish and English support. So just make sure that you are, coming to us with all of your documents and the verification needed for your application. The application is actually pretty simple. It's about 15 minutes to fill it out. Should be pretty intuitive to fill it out if you have all your your documents and whatnot. But if not, again, you can call us or visit us for any additional questions that you may have or support that you may need. And if we can ask all of the networks to please share the information about the grant. We know it's an important time to provide the support and to let businesses know that we're here to support them and help them through this period. So
in the chat, it's about the geographic footprint, like what communities and what areas are covered by this.
So this is open to all LA County based businesses. In terms of eligibility, like part of it is verifying that there's been an impact. So when you come in, we will verify like where you're located. We have a heat map that tells us where all the enforcements have been happening, right? And what has been some of the reported impacts. So let us do that part, right? Just come into the office so that we can verify your documentation and your location.
So anywhere in LA County, incorporated, unincorporated areas.
Correct.
Correct.
It's open to all of that. And question in the audience.
Can you please repeat the question when you answer so this?
Absolutely.
Good morning. My name is Elainne Machado, and I'm a patient of Clínica Monseñor Oscar Romero by Alvarado, and also volunteer with Eastsides, which is a nonprofit organization. And we have like a grocery union where by Home Depot, a lot of vendors,
Correct.
vendors, some of them are afraid to give their
Absolutely.
their documents. So how would that process kind of take place to give them guidelines of the actual? Because a lot of people are in fear in sharing their home information. And even if it's like, how could it be accessible to them, especially during this challenging times for those community members that might think that you need to file your taxes or you need to have an IT number or that kind of documentation be accessible to them, because these people are kind of in fear of
Absolutely.
anybody. And that's just what we see in the
Absolutely.
streets, right? And as a community volunteer, also in community empowering Los Angeles with CELA dealing with evictions, that a lot of people, because they have lost their income, are facing my face. It is a great concern for these resources to be available to the community. And I hope you don't come back to the community of Offender Park or something.
Yeah, absolutely. So you'll see the different, I'll address the pop-up locations first, which is that we're in different places in East LA. We're going to be in Long Beach and other spaces. But yeah, to your point of small business owners in certain communities being afraid and or worried about the information or the safety of applying for this particular grant. There's two things that I will say. All of the organizations working on the ground are ensuring that we're providing like safe spaces, right? As you can see in some of our in some of our locations, like you do have to call to make sure that you can come up, right? So we're being extra vigilant of the spaces that we're sharing. The information is all business information that, that I think part of the criteria is to be in good standing, which means that folks have to be, registered, and they have to have some sort of business infrastructure. Street vendors, right? And the folks that maybe potentially are having some of these challenges can come in if they have a business permit, which, hopefully they do, then that shouldn't be an issue, right? Because all of those things are items that they're already providing. But we are working with HICP, who is actually ensuring and working with us on keeping information, as secure as possible. So just all of those things are kind of working. I don't know, Maurice.
Yeah. Thank you so much, and thank you, Yvonne. I appreciate your comment and question. I'll also say to please contact the Office of Small Business as well for any questions about sidewalk vending and permitting. I think they would be in the city of Los Angeles, so there may or may not be applicability with the LA County sidewalk vending or street vending that is focused for unincorporated areas of the county. But again, we need to ensure there's business licensing for the application. But it is processed through HICP, which takes information privacy very securely or very seriously. And so, appreciate the concern. And thank you, Elaine.
Thank you so much for that question. We have two more questions from the chat, and I will ask the presenters, please keep the microphone close to your face when you respond. It's hard to hear on the Zoom. We do have a question about targeted outreach to those businesses impacted by the wildfires.
Sorry, can you clarify the question about targeted outreach? Is this outreach for the Small Business Resiliency Fund for wildfire impacted businesses?
Is there a specific program for wildfire impacted businesses then? Because I believe this one is really related to the ice.
This is broadly due to the extensive and intensive impact due to the federal immigration enforcement actions.
Yes.
There are multiple other programs for fire impacted businesses. I think DEO has provided nearly $27 million in grants for fire impacted businesses. I believe that there's maybe with LADC another grant program that's open right now for fire impacted businesses. There's the DEO wildfire webpage available at opportunity.lacounty.gov.
So separate from this program, but there's many additional resources for those businesses. And again, logging into the small business website and the DEO kind of services to kind of see what people are eligible for.
Absolutely. And I'd encourage the person who's asking the question to also please contact the Office of Small Business or LEEAF to navigate any potential resources for fire impacted businesses specific to their needs.
Perfect. And then the next question was related to immigration status and if that's a consideration at all in applying for these funds.
We're targeting supporting businesses here, so we don't take that under consideration. We just need business licensing and business documentation, which is what we're trying to support here. So.
Perfect. Thank you. Do we have additional questions in the meeting room? Any additional questions on the Zoom? Oh, we have a hand raised. Great. Jasmine Perez would like to ask her question. Jasmine, please go ahead.
Hi, good morning. My name is Jasmine. I just wanted to, I guess, highlight that, yeah, street vendors and small businesses are also renters, and street vendors in particular, are more vulnerable to losing their homes due to that rent debt. And so I'm wondering if there's any collaboration with the DCBA around collecting data during this application process to understand how much rent debt impact has been also done. Because I know that, yeah, these funds can be allocated to that rent debt, but it may not be enough to cover in some cases. Yeah.
Absolutely. And so thank you for that. For the Small Business Resiliency Fund, we launched this as soon as possible with the level funding. We're looking for additional potential philanthropic funding or other county funding to support the program and to support the extensive need of small businesses. I believe this presentation will be followed by DCBA as well to talk about rent relief. So I think that's a really important question and segue for the next topic. In terms of collaboration with DCBA, I think absolutely. I think I'm hoping the DCBA is also pushing out this program. And in terms of the impact, connecting with the CBOs to verify the impact is part of our process here. And Elaine, I'm not sure if you want to add anything else.
Yeah, that's what I would say. I think residents that are also business owners that are operating home businesses or primarily using their home as a place of business. The best thing that we can do is really stay connected to the community organizations like LEEAF, like Vermont Slauson, like Icon CDC, because oftentimes we can help you navigate like multiple things, right? Where there might be a grant available for your rent, but then there's something else for your business, and then there's something else that you can personally apply for, right? So to say that there is a lot of resources is an understatement, but also to acknowledge that it is very challenging and difficult to navigate them. That's really what community organizations are here to do, is to help you navigate those things, because on top of everything you have to do during the day, we're here to support. So just lean on us, lean on all of the different websites that are going to help you navigate the different funding sources. And if there's anything I can say is that both the county departments and the supervisors are doing a really great job at comprehensively trying to think of how to support our community during this time. So
great. Thank you so much. Any additional questions or comments? Anything in the Zoom room, Mona? All right. Well, thank you so much, Laura and Maurice. We're really happy to have you join us as always. And it's really exciting to see these different programs coming to fruition to support the community. We're very grateful. Let's see, I think. Well, anyway, we can stop sharing screen right now because our next presenter is with the Department of Consumer and Business Affairs. They're here to, as we teed up, they're here to talk with us about the Emergency Rent Relief Program. So I'm delighted to welcome, I believe it is Amelia who will be sharing with us today on that particular program.
Hello, everybody. Can I get a quick confirmation that you can hear me and you can see me? Yes,
Amelia,
okay.
We can hear you and we can see you.
Excellent. And a quick follow-up question. Is it possible to be granted permission to share my screen so that I can present with the PowerPoint that I have?
Yes, perfect. I think that should be enabled now. Try now.
Excellent. It's there. All right, give me 1 second and we will be up. All right. Okay, I think that we're in good shape. Please let me know if there's any technical issues with anybody seeing what it is that I have right now in front of us. And I will go ahead and get started. I am Amelia Fay-Berquis. I'll start with that. I am a senior policy analyst at the Department of Consumer and Business Affairs. And in fact, I've been the project lead for both the LA County Rent Relief Program that was launched in December of 2023 to address ongoing rental arrears experienced by tenant households who were continuing to be impacted by the pandemic and the economic impacts of it. I also have been the project lead for the Household Relief Grant, which was launched in February of 2025 in response to the wildfires, and in particular the Palisades and the Eaton fires. And that was not so much a rent relief program as it was an unrestricted grants program for survivors who were displaced as a result of the fires. And it was money for folks to use however they needed to as they worked to get back on their feet. So as we segue into this emergency rent relief program, a little bit of background. So on September 16th of this year, the Board of Supervisors passed a motion mandating or directing DCBA to launch the Emergency Rent Relief Program. And this is a bit more expansive than the last two individual programs, but in fact, it's also a blend of both. So it is specifically around or intended to support those who continue to be impacted by the wildfires. And there is, unmet needs, as we know, going on still. And so, as part of the grant program specific to the wildfires, it is really around rent relief going directly to landlords whose tenants have been financially impacted by the wildfires, meaning that their work was impacted, folks that worked in the areas, folks who were laid off, et cetera, and were unable to, to continue to pay rent. So there's that piece of it. We also have expanded the rent relief or the board has expanded the rent relief to also include small landlords and small property owners who, despite FEMA assistance, insurance, et cetera, that they continue to have debts that are impacting their ability, for example, to get their rental properties that were impacted by the fires back online and renting to folks that are looking for housing. So this will also support that. And then, of course, we have the growing economic pressures that are a result of federal policy changes, and specifically as the board laid out the immigration raids. And we all know that there have been really significant impacts upon upon immigrant communities as a result of these raids that have been happening, whether that's folks that have been actually picked up themselves in their households now have lost an income earner, and therefore they are unable to pay or to stay current with rent, or entrepreneurs and workers who have halted going out into the work world out of fear of being targeted. So the goal is to prevent evictions and from folks falling into homelessness. It is targeted relief to tenants and small landlords. And when we say small landlords, we mean landlords who own no more than 4 rental properties. And then this is also because we have had these 2 prior relief programs. This is really us moving towards establishing a permanent framework for rent relief going forward. So that's also quite exciting. So I'm going to go through the eligibility criteria pretty quickly, just because this is, we're getting these slides are a little bit getting into the weeds, but based on what it is that I shared, there are a number of categories that the board has prioritized for this rent relief. So the first criteria or the first priority are folks that have been economically impacted. Again, tenant households that have been economically impacted by the fires and unable to pay rent. And so as such, they are experiencing arrears, and this category is intended to continue to stabilize the housing of those households while also making the landlords whole. Back in February, when the board adopted a resolution around extended tenant protections for those households specifically, this is what that category is intended to do. Again, as we move into another part of this category, it is around displaced tenant and homeowner households and small landlords. So again, as I mentioned, folks who have exhausted all of their supports from FEMA, from insurance, et cetera, and have been unable to bring their units back online, or they've been displaced themselves from their own homes and they are now renting temporary shelter. And because they have exhausted all of these supports, they're falling behind in their rent for those temporary homes that while they prepared to, make preparations or make plans for their next, whether it's rebuilding, moving into their home once it's fixed, etc. And then we have the eligibility criteria around folks that are facing emergency conditions and emerging economic hardship. So I think that the two big takeaways here is that the tenant households who have been impacted by the fires, covers the time of the extended tenant protections that was up through July. And we have not put a cap on the amount of arrears that those households are eligible for. However, for the additional categories, both this one around the emergency conditions and emerging economic hardship, as well as for the households that have exhausted all insurance and FEMA funding, there is a cap at $15,000 per grant. So again, this really, I'm going to cruise through this really quickly. What I think is the most important part to look at right now is the funding. So for this fiscal year, I should say, through the remainder of it, $9.788 million will be dedicated to Group A and Group B. So to make it a little less confusing, while we have some subcategories, as you can see here, we have folks that are impacted by wildfires within Group A. The money is prioritized for those folks, and then any remaining funds after serving that population would be shifted over to support Group B, and specifically those that are not necessarily wildfire impacted, but impacted by other emergencies. Currently, we do not anticipate that this funding for this fiscal year is going to be exhausted with Group A. And so we anticipate being able to support Group B as well. And then for the moment right now, we have $10 million that's earmarked for the next fiscal year. One thing to point out that DEO also mentioned is that philanthropic dollars have been a really big part of the wildfire relief undertakings, and DCBA is also ongoing. We continue to engage around how it is that we can tap and grow philanthropic dollars that are supporting these initiatives as well. What is also a part of the board motion is that DCBA and county partners, so CEO Homeless Initiative, as well as the LA County Development, Affordable Housing Development Authority, that we're working also with stakeholders, that we're working with community side partners, et cetera, so that we can ensure that the development and the design of this program meets both the priorities of the board, but is also taking into consideration all of the feedback that folks on the ground and those that have been directly impacted are providing. And so what we are doing right now is also trying to understand the landscape that we're looking at today, because what we're looking at today is not what we were looking at a couple months ago. And also it's something that we're learning every day, right? What is the persistence of the impact of the fires? What is the persistence of the impact of the raids that have been happening and that continue to be ongoing? So, as is laid out in the board motion, we have 90 days, or we have agreed to 90 days for the launch of a portal, meaning opening of the application for folks who are in need of support. And so we have here a little bit of a timeline. Mid-December is when we expect to launch, meaning all infrastructure is in place and an application portal is open to the public. So we are currently working closely in partnership with, especially with our immigration or immigrant serving organizations around designing a program that is really thoughtful of all the vulnerabilities of folks who are going to need assistance or going to be applying for assistance. One thing that I think is really, really important for folks to know is that this is a rent relief program with the dollars going directly to landlords. So this is not a program where tenants apply per se. It is a program where tenants can refer their landlords for support, but the board's priority is that this is a program that is working to ensure that landlords are made whole while also stabilizing the housing of the tenant households who have been impacted. So I will stop there, and we welcome any questions, comments, feedback, etc.
Thank you so much, Amelia. Do we have any questions in the meeting room for Amelia? Well, I'll step forward with one question, Amelia. Thank you so much for sharing the timeline. My understanding is that the priority of the funding is for those impacted by the wildfire, but then there's that secondary category. When do we anticipate that the first category of resources will be served and then funding might be redirected to that second category? You mentioned that the likelihood was not all of the funds would be expended in serving the wildfire population. So there should be funds made available to that secondary population, but what's the timing on that?
Yeah, so the way in which we're going to be treating this program is that we're not going to be, how should I say this? There's going to be an application, an open application period. So the window will open, the portal will open, actually, I should say, literally, and folks can apply during that time. And so once the deadline ends and the portal is no longer open, that is when we will take all those applications and say, okay, what are all of the what are we looking at? And once we understand what we're looking at, then it's really kind of a parallel approach as opposed to, okay, so let's get everybody here who is, wildfire impacted, and put those folks that are requesting emergency assistance for other reasons to the side. We have a pretty robust system and infrastructure already in place for assessing initial eligibility. Do they meet the very basic criteria, right? Do they fall into, for example, category 1, where it is the tenant household was laid off, impacted, et cetera, as a result of their work being located in fire zones, et cetera. And so what we anticipate is we expect that we will know quite quickly once the application portal closes what it is that we're working with. And then we start working on reviewing those applications and making decisions as quickly as possible and then dispersing funds in a timely turnaround fashion. So I hope that answers the question. It really is, I think instead of like a tiered approach, it is a parallel approach, because we also know that while there is prioritization for making sure that folks that have been impacted by the wildfires and landlords are made whole and tenants continue to be stably housed and are not facing ongoing arrears and potential eviction for non-payment of rent, we also know that there is that immigrant communities are in dire straits right now here locally and across the country as a result of federal immigration policy. So we're doing this in parallel as opposed to a tiered approach.
Yeah, thank you. That absolutely answered my question. It's wonderful to know that the opportunity exists from day one for both populations. get the applications in there, and then of course the funds will be distributed as available. We do have a hand raised from Jasmine. Jasmine, please go ahead and ask your question.
Hi, thank you so much for the information today. I do have a couple questions. And yeah, I'll start with just to confirm, are landlords not mandated to participate in the program just because their tenant has rent debt?
That is correct. We cannot force a landlord to participate in the program.
Okay.
So, what I will say, Jasmine, is that this is something that we tackled and really thought through with the LA County Rent Relief Program, because that was also, we cannot force a landlord to accept our money, right? But what we can do is we can do really proactive outreach, really proactive advertising, and really, make a compelling case for them to participate. I think that one of the things that we found, and that was a part of the LA County Rent Relief Program, is if a tenant was facing an unlawful detainer or an eviction order, one of the things that we did is we did proactive outreach and engagement with the landlord to say, hey, part of what it is that you are agreeing to or agreed to when you applied for these funds, which currently it will be 15,000, prior it was 30,000, is, pursuing an unlawful detainer is expensive. And so there is the option to be made whole by receiving this grant, or if you choose to continue to pursue an unlawful detainer, then you are no longer eligible for this program. And you may find that, number one, you are not made whole at the end of the case. And in fact, you've spent more money, going through the legal process of evicting a tenant. And so trying to make a compelling case to landlords of, look, tenant households, they are not just withholding money. There's been real economic impacts as a result of these emergencies and disasters that have been happening. We want to support keeping those tenant households housed, and we want to support making you whole again. So let's work together on this. So that is the goal.
Yeah, I think in that case, I would suggest like mandating landlords to provide notice of rental assistance, um, just so that both parties are aware that this is optional. And I say that because understanding the eviction process, I work with the Stay House LA program to navigate these cases. And during this process, access to rent relief is like the easiest way to settling a case
Yeah.
when the case is based on non-payment. And at the time, like Stay House LA also doesn't have access to funding. So like now through December, now through January, when funds are distributed, I think a lot more, a lot more impacts are going to be happening just like every day. Evictions are still happening until the eviction moratorium is in place. Hopefully that is in place by the supervisor soon. But yeah, just I think it would be helpful to like maybe also potentially collaborate with Stay House LA and in getting those referrals or getting mediation with landlords and tenants before they go through their eviction process.
Absolutely. And Jasmine, I have good news for you. Stay Housed LA for LA County is run by the department for the Department of Consumer and Business Affairs. And so there is major intersection between the work that we're doing around rent relief and our Stay Housed LA partners. And so we are working with Legal Aid Foundation. We are working with Housing Rights Center. So we actually are the county entity that is operationalizing Stay Housed LA. So I think that we are in a really privileged place to be making sure that both programs are synergistic. and that we're also proactively undertaking process improvement and executing process improvement as we go along based on the lessons that we're learning. And that was something that was really, really important to us with rent relief, is that as we learned new things of, oh, we didn't think about this as we were lifting this program up, but we're seeing that this is something that's coming along. For example, tenants notifying us, oh, hey, a UD has been fired, I've received an eviction order from my landlord. That was actually something that we said, started experiencing shortly after we launched the LA County Rent Relief Program. And that's when we said, hey, we need to start thinking through how it is that we can, prioritize review of these applications if they're, on hold right now because we're reviewing other applications. How do we kick that up for review? But also, how do we immediately intervene, engage with the landlord, and hopefully compel them and inspire them to continue to participate in this and to move away and dismiss a UD in exchange for review of their application and potential funding. So thank you so much for that feedback. And I think that one of the things that we really want to see as part of this, launching of a permanent rent relief program is that we're getting feedback from the public always, because we do really want this to be a thoughtful, equitable, and impactful program.
Thank you.
Yeah.
Thank you so much. Do we have any additional questions or comments for Amelia? All right, I think you've answered our questions, Amelia. Thank you so much for joining us today.
Yes.
We really appreciate the information.
Thank you.
So with that, we're going to take our 5-minute kind of bio break for everyone in the room to kind of get up, stretch your legs. So give us just a few minutes and we will come back with a presentation from Centennial Partners, followed up by an update on the California Accountable Communities for Health Initiative. So we'll be back with you. Let's see, we are time checked at 9:58. We'll be back by 10:05. See you just in a few minutes. Right. Well, welcome back, everyone. We're going to go ahead and get started with the next set of presentations for our meeting. We're very excited, as always, to be welcoming our partners with the Centennial Partners Program to give a recap of the Community at Large meeting that was hosted just a couple weeks ago. It was a really exciting event. We had wonderful turnout, and I'm delighted to welcome Claudia and Brittany to come share with us some of the highlights of that meeting. Claudia, take it away.
Thank you, Heather. Good morning, everyone. I'm Claudia Cardenas with Community Outreach with the Prime-Sirr and Centennial Partners team. And joining us today is our new project manager, Brittany. Brittany, would you like to introduce yourself?
Yeah, thanks, Claudia. Hi, good morning. I'm Brittany Arcenaux. I'm new to the Centennial Partners team. And as Claudia mentioned, I'll be the project manager leading the master plan and the SEIR in partnership with DEO. So we're really excited to talk a little bit about the event on the 27th. As this was our first community at large meeting, we really wanted to take time to orient the community members to the site and the campus itself. Also, we talked a little bit about the overall framework of the site and circulation paths, and we're really offering different design solutions for how we could program the space with open amenity spaces and parks and plazas, and also thinking about how people get to the site and how they move through in terms of walking, biking, or driving. So it was really great. We had a hybrid approach where we were able to present the presentation and then also have our remote community watch parties, thanks to the really hard work of our community partners who organized and hosted those events. So what we're going to do is we're going to talk a little bit today about the results of our feedback. We provided a summary and then also put together a little video that really provides some imagery of, just the community engagement. So I'll pass it back to you, Claudia. So what we did during the
Hey,
remote
Brittany and Claudia, is there audio accompanying the video?
there should be music, but it's okay if it's not
Yeah.
working. We can
If it's
kind
just
of
music, then
narrate.
we're not missing much. Okay, thank you.
It's okay. Yeah,
Yeah.
we can just narrate. So I think what we had at the offsite events was workshop exercises where individuals filled out worksheets expressing what design features of the concepts they preferred, what kind of programming they wanted to see across the site. So there was lots of engaging discussions between the groups, sharing their visions, and then facilitated by both Centennial partner staff and then also our consultant, Rios. And then we also had virtual breakout rooms for those participants that were online. So Claudia, I'll hand it over to you.
Thank you, Brittany. So as Brittany mentioned, the main presentation was held via Zoom, but we did have 3 of our partners hosting in-person watch parties. So we are extremely grateful to the Wellness Center, Alma Family Services, and Eastside Leads for hosting these watch parties. And we were able to achieve a combined attendance of over 200 participants. Key takeaways included how the community would prefer moving around the campus, with walking being the preferred mode, followed by bus transportation and car access. Families and seniors would like to include drop-off areas and shuttle service. The preferred uses include spaces for gatherings, events, and connection, green spaces to relax, and areas for physical activity and exercise. Overall recurring themes called for a design that is inclusive, safe, and culturally rooted, with an emphasis in affordable housing, safety, cleanliness, education, and wellness. The findings to be implemented into the next design include safe walkable paths with shade and seating, green spaces, calm environments that support relaxation and activity, flexible spaces for family gatherings, small events, and cultural expression, and accessible design features like lighting, rest areas, drop-off areas, and clear signage. Oh.
Claudia, I think just one thing I wanted to point out on your previous slide is, what we can look forward to. So we're continuing to do outreach and garner feedback from the community. So next Thursday, we'll be meeting with the Youth Coalition at Legacy LA to really draw in the voices of the youth in the area and better understand, how we can continue to engage in conversations. So we're essentially going to repeat many of the same activities that we held in this workshop and make sure that that feedback is represented in the next iteration of the master plan. And then in early December, we're going to share an updated site framework of the master plan at a second community at large meeting, which we're really looking forward to. So keep an eye out for an email coming from us with a date. And again, looking forward to continuing conversations. And if at any point anyone has questions about the concepts, the master plan process, wants to have dialogue, wants to provide additional comments, we are more than happy to chat. Here is our contact. You can see my email there. I'm always happy to hop on a call. So I'm excited to continue working with you on this.
All right. Well, thank you so much for the presentation. Do we have any comments, feedback, questions? Okay, give us a second. We got a couple questions in the audience. Got it.
Good morning, Christina. I just actually wanted to comment on the screen as we're not actually able to see all the details. Oh, thank you.
I'm sorry. I think it was a little faint, but think I heard you say that you weren't able to see all the details on the screen.
Yeah, I think we had 2 requests for the contact, like better visuals on the contact information, Brittany. So I think we're zoomed in a little bit more. I think that is resolving the questions y'all needed. Okay, very good. So I think we've got it. Thank you so much. Any additional comments or questions? Oh, Alejandro.
Hola, buenos días. Mi nombre es Alejandro Castro.
Good morning. My name is Alejandro Castro, community worker.
De nuevo, buenos días. Gracias por esta
Good
oportunidad.
morning. Thank you for this opportunity. I'm a community worker and only interested in knowing if you have already set up the affordable housing percentage to share this knowledge throughout the community.
Good morning. My name is Alejandro, and I'm a worker for the community. I want to know if you've defined how many affordable housings or the percentage of affordable housing and that's available to the community.
I can Ben or Claudia, do you want to go or you want me to respond?
Go ahead. No, please go ahead. Yeah.
Hi, Alejandro. It's great to meet you. We, as part of this master plan, we're working through a community benefits agreement where we'll be making commitments on the number of affordable units that will be included in all future development. My understanding is that right now we're discussing 25% as a minimum, but we're looking for ways and funding mechanisms to increase that amount.
Right. Thank you. Do we have additional questions? Oh, we have a question from Vivian. Is that mic working again, Anna?
Yes, good morning, Vivian Escalante. So I'm curious as to how much of the housing is actually going to be prioritized for especially as housing for our elderly.
I'm so sorry. The audio is cutting in and out. I'm not able to hear you.
Got it. Okay, thank you. I'll go ahead and repeat Vivian's question. Vivian was asking about the prioritization of housing for the seniors, the elders in the community.
That's a really good question and definitely something that we're looking into in terms of our funding sources. What we're trying to do with this scale of housing is to really accommodate a range of housing types. So absolutely trying to find ways for senior housing, housing for families, housing for single individuals. We really want this to be an inclusive community. There's some different strategies that we can take in terms of providing senior housing. One mechanism that we're looking into is funding sources that specifically offer subsidies for senior housing. But another one is just thinking about, from a design perspective, aging in place. How do we design housing for people with different accessibility needs? So it is absolutely something that we're planning on including in this project. But in terms of how many units and how that'll manifest, that's what we're working through the master plan. So I'm writing down this comment as well, and I welcome you to continue your engagement. And if you want to share this feedback at our next community at large, that is welcomed as well.
Thank you, Brittany and Claudia. Do we have additional questions for our speakers? I know this is a long project with a long, long runway. So all of these points need to be brought forward again and again. Do not give up the momentum on this commentary, because the moment today may not be, how many units of one kind or what the design is, but that conversation is and is coming. So we want to keep bringing those points forward, keep, kind of emphasizing and advocating for the community benefits and the community needs that this project will serve. So, and we know we have good partners in Prime Store and Centennial partners to help guide us and support us in this process of making this incredible project come to reality and serve the community first.
And
So,
sorry, just to add to that, just to add clarity. So we do have a very long timeline, and we're not currently proposing that we're building anything right now. What we're doing is working on the master plan. So this will be going until about next summer. And in the community benefits agreement, there is a commitment from Centennial partners that anytime a building is built, that we're engaging in dialogue with the community and co-creating the development. So it's probably not for another year or so that we're actually going to be designing the programming, number of units, what do those units look like? Right now, we're just talking about at a high level, general uses, general locations of buildings, what do the streets look like? Those are the conversations we're having about the master plan. So we will definitely be having this conversation many more times.
No, thank you so much. I think that makes a lot of sense. So about a year of this master planning process to kind of envision the remodeling of the entire campus, not getting into all the specific detail yet. And then as we move through the process, it'll come more to ground level, how many units, what types of units, like where the throughways would be on the campus, other services and other, building opportunities. So I think that dovetails really nicely with, we're going to have another little update presentation on the SEIR component of the master plan. Maurice is going to come back and just remind us again of that participation in that dialogue. And I think that goes very nicely to your point, Brittany and Claudia. Thank you so much for sharing with us highlights of the community meeting. We're excited that there are many to come, and we look forward to that going forward. And I'm going to turn it back over to Maurice.
Thank you so much. Your slide. Okay, great. And thank you, Claudia and Brittany. Apologies if a quick note about the SEIR was brief earlier. Want to make sure to share this slide in order to accept comments from the community on the SEIR. So as I mentioned before, DEO is serving as the lead agency in preparing a subsequent environmental impact report. That's the SEIR. It was released on Friday, September 26th. The SEIR is, in addition to the county's previously certified 2014 LAC USC Medical Center Campus Master Plan EIR from 2014. It's intended to inform the decision makers and public about potentially significant physical effects on the environment, to identify ways to avoid significantly reduce environmental impacts through feasible alternatives and/or mitigation. We're conducting a program EIR to evaluate the campus as a whole, looking at a maximum envelope of development that could be implemented over a period of years. The SEIR will be completed in parallel to our ongoing master planning and community engagement process, which will look at finer detail than the maximum envelope to determine with more specificity the right mix of uses, campus scale, program infrastructure, transportation, and phasing for implementation. And I believe Primestar shared about the community benefits agreement that we're working on in parallel. So we issued the notice of preparation indicating that the SEIR process is underway. The official comment period runs through October 27th. Please submit any comments to General Hospital at opportunity.lacounty.gov, which you can see on the slide here. Any questions? Great. Thank you so much, and appreciate any comments and feedback you have.
Right. Thank you so much, Maurice. I really appreciate it. And yes, we're sorry Kristen wasn't well enough to join us today to give the message herself. Thank you so much for standing in for her. So our next presentation, we're very excited to kind of conclude today's meeting with a report back on the California Accountable Communities for Health Initiative. This is a wonderful program that has really supported the mission and the message of the Health Innovation Community Partnership for many years. And with that, I'm going to turn it over to our program manager, Christina Cardenas, to walk us through it.
Testing, can you hear me? I have a light voice, so hopefully you can hear me. Okay, perfect. Well, I'm last. I'm like between you and going home, so I hope I'll make it very. You can't hear. How about now? Testing. Can you hear me now? Okay. So I'm Christina Cardenas. I am a program manager here at LA General Medical Center Foundation. So happy to see all of you today. I will be sharing a little bit about the California Accountable Communities for Health Initiative, CACHI. Oops. Okay. So CACHI was established to help modernize our health system. It was built to improve community connections to healthcare providers. We know that doctors and providers alone cannot improve the health and wellness of community. It really takes a village. This very HICP is the very epitome of that mission and vision. So in 2017, we became one of 12, this is an error, one of 12 sites to participate in the first CACHI cohort. We formed a task force of pediatric medical providers, CBOs, clinical providers, community members, many that are here, HICP members, and we piloted a project to enhance, improve trauma-informed patient-provider linkage pilot program to increase ACH screenings for pregnant mothers while improving pregnant patient referrals to the Wellness Center. This was a program that we really worked on thoroughly to improve clinical connections, and we also were able to support and enhance HICP efforts through the process. And the goal is to transform the health of entire communities, not just individual patients. In 2021, we again joined CACHI, now with 36 sites, so it did grow, and our current efforts are aligned with state initiatives. How about now? So now we are working with 37 other sites. Our current efforts are aligned with state efforts focused on child wellness through trauma-informed care, family-inclusive strategies, and increasing access to behavioral health care at LA General Medical Center. So we're very excited to be here today to provide updates. We also wanted we're going to a convening after this, so we really wanted to also ask for your support. We did put note cards in the back. We do want to find out, because CACHI is a very coaching, supportive initiative, we did want to also take back recommendations for what additional support we would like as an HICP for improving these resources. And then lastly, CACHI is creating a new vision for health systems, aligning interventions for maximum impact, promoting prevention and sustainable funding for critical community institutions. Many of you are here today. Without your efforts, in community would not have the success that we have. I do want to show a video. This is a video of our CACHI convening, just to give you an example of, there's so many sites doing incredible work, so you can kind of see a little and hear a little bit about the efforts.
Great need in our community. That's why I'm here today, and that's why I'm continuing to work hard with LA reentry programs and other ACH organizations to see if we can make a greater difference.
We got to meet everyone from ACH across California, learning about what they're doing and listening to their stories.
One of the things that keeps me going when the work gets hard is understanding of the power of residents and the joy in seeing residents build power.
I really appreciated the workshop on healing circles. It was a great space to connect with everyone, learn from each other, and just have a space to focus and engage on the topic.
Really happy
CACHI allows us this opportunity to work with these youth in Marin as we continue to grow.
Working with the CACHI network has changed my work because I'm a government employee. We're always looking for ways as the health department to center community, engage, and also share power with community. So why not ask the community what they need and how we want to design our programs and services?
Being a part of the CACHI network has allowed me to help break down silos in the Ventura community, especially in regards to some changing times in regards to funding streams. It's been really important to make these connections now to help us rebuild and reframe structures to help best support our community.
This work has always been here. People have always been doing this work, but really seeing ourselves as a statewide coalition that we're not here representing just ourselves and our individual ACHs, but the state of California and the people of California, and really meeting folks where they are and honoring them and their lived experiences.
Community is everything, and I think the most valuable thing about CACHI and these ACHs, it's all about community. And I'm just so grateful to be here and to be a part of history.
Okay, so that was this little snippet of our convening. As you can tell, it's all about bringing together various groups similar to, so we represent HICP in these meetings. There are 36 other sites. I just want to point out, go back to the site list. 37 sites working on these 7 issue areas. We are in a regional cohort working on youth well-being and behavioral health. So we're working alongside Marin, Shasta, Humboldt, San Francisco, Alameda County, and Compton are all working on youth well-being. But in terms of the regional sites, there's about 9 Southern California sites. So today we're meeting with those sites, but it is a huge, huge convening. The other beauty of HICP has been to serve to support as a backbone to HICP. So I just want to point out a few highlights in terms of updates. So the CACHI model, rooted in accountable communities for health, focused on technical assistance and local coaching to enhance our partnership model, as well as equity and local community engagement through Health Innovations Community Partnership. The result has been authentic, inclusive, and dynamic civic engagement process for community stakeholders to shape and support innovative partnerships, policies, and programs to address community needs through the lens of health. And just some quick accomplishment, our site has received technical assistance and coaching to improve these efforts. We have been able to support local projects on campus. We have focused on DEI, equity practices, advising the county on projects and priorities, securing community benefits for current and future residents, local hire, affordable housing, and then building focus-driven collaborative of public, private, and community partners, building leadership and capacity amongst community. And then the one that we're really focusing on is building a pitch deck and a sustainability plan for secured funding to maintain HICP as well as local partners. And so we've been doing this through a centered community voice, multi-sector engagement, and aligning systems and priorities towards healthier, stronger, equitable communities. So this is the CACHI model. All the sites, all the interventions of the sites are rooted in those interventions. And then where we're going, just wanted to provide a quote that was provided by we did an assessment of HICP members, and this was a quote that was provided, that patience and perseverance are key. Developing an ACH takes time. It isn't easy, but it's worth the effort. With the right support, tools, and guidance, ACHs can navigate the comprehensive multi-year approach needed for community change. Some of our efforts didn't bear fruit in year 1, but are starting to flourish now. We're now ready to leverage the training we gained. All of those things we have been so powerful. We're excited and grateful for what we've been able to achieve. So we're very excited as well. I want to share some of our goals for 2026 is to expand CACHI's organizational capacity to support and connect ACHs as leaders of a statewide movement of community-driven multi-sector partnerships. 2, raise awareness of and advocate for the ACH model as a scalable community-rooted framework for cross-sector collaboration and public health innovation. And 3, mobilize ACH network around key issues critical events, and infrastructure opportunities with a unified strategy and shared purpose. So we're very excited. There is so much resource that CACHI provides amongst these 36 sites, and they really are working to ensure that we have all the tools at our disposal for resident capacity building, for improving our membership, as well as looking for sustainable funding. So we're really pleased to be able to bring this back to HICP. And we are working with CACHI to also ensure that we have a seat at the table when it comes to state policy decisions. And a lot of it, as we all know, with the federal government, there's so much pending, so much unknown. So CACHI is really going to be able to bring more of that state advocacy through all the ACHs. So we're really excited to be part of such a innovative and strong network. And then lastly, I did want to invite everyone, one of our upcoming webinars. These are open to all of our HICP members. And the next one is going to be Voices at the Table, Partnering with Residents to Shape Community Health. And we're excited because CACHI has really brought so many community voices to the table. Many of the membership of CACHI are community residents. So we're excited to bring this information to our CPHT, our community health workers, to any of you that are working with community members and would like more capacity. In the new phase, CACHI is really working to support with a lot of the leadership capacity. And this was one of many, but we definitely wanted to bring this one because it's the end of the month. And if anyone's interested, what we'll do is we'll send out the registration through our HICP network. And if anyone wants to attend, it'll be through Zoom. So, and then I'll pass it to Heather if there's anything else. Heather was there since day one, so.
Thank you so much, Christina. We're very excited to share some highlights and updates from the California Accountable Communities for Health initiative. You can hear it in the name itself, Accountable Communities for Health. The point is that the systems that govern the health system at large, the public health infrastructure, is here to serve communities. It's here to make communities more healthy. And we need to hear from and partner with communities to make sure that happens and that all those systems are accountable to you. So that is the initiative and the importance of the Health Innovation Community Partnership, this body here today. But we want you to know and recognize that this is one of 36 such programs up and down the state that are all trying to charge that same mission of making the community voice at the center of the public health system. And in all different ways, different communities have targeted different issues as their priority issue area, but the goal and the model is the same. Put community at the heart, put the community messaging and the community voice at the forefront, and then make sure that all of those systems are accountable to those community members that they're here to serve. So thank you so much for the presentation. We're super excited. Again, if you have a question or a comment about this program and this initiative, please write it down for us and give it to Christina. She's headed, as she mentioned, to an event with all of these sites, and she'd love to bring your voice and your question forward in that space. So please contribute. We would love to hear that. So with that, I believe we are at the end of our program today. Very exciting. We are, as always, delighted to welcome any partner feedback or any comments. Does anyone from the partner organizations want to share out from anyone have anything they want to share? That's what I'm trying to say. Does anyone have a slide or an announcement? Okay, Miss Vivian.
Thank you and good morning. My name is Vivian Escalante. I'm the CEO of Boyle Heights Community Partners, and I'd like to invite everybody to the Archives Bazaar, which is where all the historians from different locations throughout California will be gathering at Cal State Los Angeles, right here in City Terrace, El Sereno area. And this is going to be held on Saturday, October 18th. The doors open at 10 and they close at 3. But it's an amazing event to go ahead and learn more about the history of the communities in which you live and to find out more about how you can also get engaged. Greatly appreciate you participating, and please come by to say hello to me and our team at Boyle Heights Community Partners at the Archives Bazaar. Thank you.
So that's a week from Saturday. Can you give us the information, Vivian? We can share it out with the people on the HICP mailing list. Perfect.
De nuevo, buenos días y gracias. Quiero felicitar al
Again, good morning. I want to congratulate the project of rehabilitation of the Hospital General of the old building. I want to congratulate you for, taking on the risks and everything you do to help the community. Thank you.
I'd like to thank this big project to rehabilitate the old General Hospital building. And the courage you have to face these risks that are coming up in these very difficult times. I congratulate you. Thank you very much.
Thank you so much, Alejandro. Do we have any additional? Oh, great.
Well, I would like to invite everybody to Los Angeles Trade Tech Community College in Washington and Grant. They're going to have a resource fairs for construction and community planning and advocacy, addressing the homeless needs and resources in the community to empower community members to educate, find education, especially job placement, like create a bridge for the homeless, because I know they're mentally challenged. And this is a great site to include them and to be more inclusive, and also to see what are their specific needs that we can address as a community and advocate for housing for everybody, right? For the city of LA, and see how can we continue to making the city better than what it is. Thank you.
Thank you. That sounds like a wonderful resource. If you have the information, if you could share it with Anna or Aurora, we'll send it out to everyone on the list. Fantastic. Thank you so much. I noticed that we have a raised hand. Jasmine, if you'd like to ask your question, Jasmine, or make your comment.
Yeah, I just wanted to invite everyone on behalf of Eastside Leads Coalition to sign our Boyle Heights Community Plan priority letter. I've dropped it in the chat. And yeah, if just a bit about Eastside Leads, we do anti-displacement work through land use policy, as well as tenant rights education with the Stay House Delay program. And we will be sending this we gathered information, community priorities for the last couple years, and have been advocating for the Boyle Heights Community Plan update for some time now. And we will be sending this letter to Council Office Isabel Jurados later this month, and it would be really appreciated to get some support from our colleagues here. Yeah, if you have any questions, feel free to contact me directly, or Pamela as well. We had intended to send more information. I don't know if that was sent on behalf of Pam.
And I wanted to invite everybody to the Wellness Center on October 21st. We are going to be having a My LA 311 training so that you can learn how to report neighborhood issues such as when they need to come and clean your streets, or report issues or anything like that. The training will be from 10 a.m. to 11:30 this upcoming October 21st at the Wellness Center, and it will be offered in Spanish for this first one. So inviting everybody. We have a registration link that we will be sending over, and then we will keep you posted on the next one. Thank you.
Great. Thank you all so much for those wonderful announcements. And we do have information in the chat related to the project that Jasmine was just telling us about. So we're grateful for that, Jasmine. And we will also make sure to share that out vis-a-vis our HICP distribution list. I also have another comment I'd like to read from Tara Omrani from the Peer Program at IMCES. We've been partnering with LA County DMH for the past 36 years. Our peer program currently has openings for youth and young adults aged 12 to 25. We offer psychotherapy, educational and employment support, case management, family support, and medication management. Tara has left her phone number and her email address in the chat. And there's also a flyer about the peer program. So if you know youth and young adults ages 12 to 25 who needs these types of supports from DMH and the peer program, please do be in touch with Tara. So lots of wonderful, wonderful opportunities for participation and support and strength in community. We are so grateful to all of you for sharing today. As a quick reminder, this presentation is recorded. The materials and all the flyers, etc., will be made available on the HICPLA.org website in about a week's time. And we'll also be sure to be sending out these materials via email to those on our distribution list. As a reminder, our next meeting will be on Friday, November 7th. We invite you all to come back and join us here in person at the Medical Center in the Inpatient Tower, or of course, we're always available via Zoom as well. So thank you so much, everyone, for joining us today. Thank you, as always, to our fabulous presenters, and most importantly, to the community members who come out and support this initiative. We obviously couldn't do it without all of you. So thank you so much. Have a wonderful day and rest of your weekend, and happy Indigenous Peoples Day this coming Monday.